So part 3 of Richelle's book club here of what changed my mind when it came to traditional medicine versus functional medicine and the blend of them all. This one's a big one. Definitely more, again, than a weekend read. Dense. So a lot of facts, a lot of studies, but really something that you would want to know about, because the hot topic when it comes to hormone therapy or bioidentical hormone therapy, whichever one you're researching about, is is breast cancer caused by hormones? Okay. There's a lot to go into when it comes to that singular question. But why I like this book to enter the conversation is because this is written by a medical oncologist. His name was Dr. Arvim Blooming. He is still around. I mean, he's passed away. But the story behind this book, and as it goes, is Dr. Arvim Blooming was treating breast cancer patients as we would normally think: immunotherapy, chemotherapy, radiation, surgery, etc. And as most of us would know, standard of care, if you don't know, after you've had a hormonally positive tumor removed, extracted, and then taken care of, is to place people on anti-estrogen therapy or hormone blockers, essentially. And, that was and still is quite largely the mixture of belief. Until this medical oncologist's wife came down with breast cancer, and she went through the process and procedure and then was placed on the hormone therapy blockers. And she said, "No way, Jose, I feel crummy," as most women do. And she got off and she said, "I need estrogen. It matters to me." And that threw him through the roof, right? I mean, it totally goes against the grain of everything that he was taught, practices, and believes. So that's the backstory to this book. This medical oncologist now has his wife saying, "I can't finish out proper procedure and protocol according to what NCCN guidelines are, and I'm going to go on hormone therapy. Just watch me." I like her. She sounds a lot like some people we know. But she did, and she did well and successful on it. And it got him started into the medical literature sleuthing of, well, can a survivor of breast cancer use hormone therapy? Is there a place for that? And can breast cancer even have a place for hormone therapy? Is there a place for that? And so this book will go through his evolution, a little bit of his story, but most of it is a story in the context of what studies, what literature, what experience then shaped his trajectory and his current now practice and thinking. Now, a caveat about this book: he is only going to talk primarily about synthetic hormones. He's not going to bring into the conversation bioidentical hormone therapy. That was not the focus of his research. But why I like that and why I think that's interesting is because people who are generally looking for bioidentical hormone therapy, it's because they think that it's safer, gentler. It mimics the natural molecular chemistry of what we have in our body, so it probably behaves better. It's more natural, even though it is technically synthetic. When most people want to step away from the synthetics right now, which are derived from patented chemicals, usually a pregnant horse urine source, when it comes to estrogen, progesterone, and testosterone, that are being used in the traditional medical model for hormone replacement therapy, gels, creams, patches, and things. He actually only looks primarily at research that uses the synthetics. And so it's a very interesting conversation because, spoiler alert, there is a role, there is a place, and there is an approved season for the use of estrogen, synthetic estrogen, in breast cancer therapy survivors. I'm sorry, not breast cancer therapy, but breast cancer survivors. And so it's curious to me because if there's a role for synthetics playing in breast cancer survivor therapy, is there also a role for bioidentical? Because technically, yeah, there are different molecules, but interesting question, right? Now, he will argue against bioidenticals in a short little paragraph in this book, so just FYI. But why I like this book is because it really opens up the conversation as to hormone therapy and breast cancer, which, as we all know, I think that statistic is 1 in 8 women have these days or will experience breast cancer. And so this is a very big topic of conversation when anybody's considering hormone therapy. And it will give you a better understanding of this world and is definitely something that I recommend everybody get into, especially if you have a family history of it. So that's all I'll say on that without going into the nitty gritty of it, but really good book, a lot of resources, and I would definitely put this one on my shelf if I'm also considering hormone therapy, especially in the presence of a family history of breast cancer or you yourself being someone who is a survivor.